the last time when you were here on Radio Sai, you mentioned about the hospitals and said the hospitals signify life. They are a living institution, and you mentioned that the hospitals have a unique resonance of their own because of the way they are set up. And today, if we see the healthcare scenario in India, you see on one hand the medical tourism, which is like a $6 billion sort of industry. Healthcare has become an industry, and I remember the day I saw an ad which said that you do 4 tests and another 2 tests will be free. So it's almost become such commercialized. So in this scenario, it's really so heartening when you see that the hospitals are functioning in the same way, the way they used to function before. And in fact, a lot of steps have been taken in the recent past to ensure that it goes on.
See, one of the things which the Central Trust has done in the last 3-4 years is to ensure that the major equipments which require replacement are replaced. Because one hospital is more than 2 decades old, the other is more than a decade old, and very highly specialized equipments like the MRI and the CAT scan and things like that need replacement once in 10 years. We had done it about 10 years back, and now the time was due for replacement. And considerable capital expenditure has been incurred in bringing these equipments to the hospital. And today, most of the departments have the state-of-art technology. Swami, when he started the hospitals, gave them the state-of-art technology. And every decade, obviously, the technology goes on changing and improving. And these hospitals also require upgradation. And the last 3-4 years, the equipment that were required to be replaced and some which need to be added have all been attended to by this trust. And therefore, the quality of delivery of service today in the hospital continues to be as high as it was when Bhagwan was with us. So we owe to the hospital, of course to Bhagwan himself, that the quality of service which he was keen to provide continues to be provided now. It's a major task, and the directors of the hospitals, the doctors of the hospital, the managers of the hospital, all of them had been very conscious of the fact that they have to continue to do well and to keep the standards which Swami insisted when he was there. So that is, I think, also very important, that there is a high morale in the service sector, and because this is not an industry for us, this is a service, and you require enormous shall we say selflessness to keep this going. And all the people at various levels, both medical and non-medical, have been putting their best efforts. And I'm sure that that spirit of service which Swami had provided earlier in the minds and hearts of these people will continue to be there, because I think they're all still so much influenced by Swami's teachings in their own lives.
And the hospital continues to have the national and international conferences.
Yes, one of the things, as it happens in the case of university also here, every year some departments do conduct international conferences, well attended, and quite a number of research papers are also published from these hospitals. So on the whole, the environment is not only service oriented, but also increase in the quality and competence of the professionals.
And another new initiative that we saw in few months ago is the first alumni meet. All the PG students, the DNB students of the hospital met, and that was sort of a homecoming for so many of them.
Yes, I think in the last, I think it's more than 15 years, there have been nearly about 200, 186, 190 doctors who had got their degree, DNB diplomas. And one of the unique things about the hospitals is that those who had come here and joined the DNB program had passed, and well, the all India average of pass in the DNB exam is about 25 to 30%. The percentage of pass from these two hospitals is almost 100%. So it's a record by itself in the country. So they wanted to get together and see how best they can support the institution. I'm sure their annual meet will give them opportunities of finding out methods and means by which they can contribute to the continued growth of the institute. We also have done, one of the important things that the trust has done is to undertake drinking water supply to the 3 mandals around Puttaparthi, and to cover about 118 villages which were not covered in the first phase. So these were at that time for some reason not included, but after assessing the need for it, the trust undertook expansion of the original water supply project in Anantapur district, and have completed, and we'll be handing over shortly to the government for continued maintenance. And because the Puttaparthi has become a municipality and their requirements of water also have grown up, so we had made arrangements to extend the facility by taking it up and incurring more expenditure towards provision of increased water supply to Puttaparthi town also. So I think all activities which Swami had initiated in the fields of health, education, public utility are being maintained and continued by the Central Trust now.
And this trust also has set up water purification plants.
Yes, as a part of provision of clean drinking water in many of the villages in Andhra Pradesh, the governments also had initiated some, but they're also asked whether charitable trust could also participate. So we had done, we had taken up almost 100 villages in which these water purification plants are being installed. And you know, when Swami was there, he also had provided relief to people affected by the earthquake or by tsunami or by any natural disasters. So the trust continues to provide relief for people who have been affected by such natural calamities, whether it is in Orissa or in Andhra Pradesh or even in Kashmir now. So where I think the organization had done tremendous work in Kashmir, and arising out of our experience in dealing with these natural calamities, there is a disaster management, also Institute for Disaster Management had been taken up, and quite a number of our own several volunteers have been trained, and their expertise is now sought by police establishments in many states, notably in Tamil Nadu and Kashmir itself. They had a very recently conducted training program for the police in Kashmir. So I think we will continue to use our organization and this expertise that we have gained in attending to these relief activities and provide, wherever it is possible, you know, both immediate and long-term relief. In Orissa, Swami had constructed houses for those affected, and the Central Trust continued to do so and completed the second phase in Orissa. So I think the idea is that all the activities which Swami had initiated should be continued by the Central Trust in the same spirit in which Swami did. After all, the spirit of service which Swami had shown must continue to inspire people working in his trust and in his institutions. I think all the people who have been working in the organization and the various institutions of Swami are now continuing, I think, with the same commitment, with the same zeal. That is why I said successive generations also will look after these institutions with the same spirit which the current generation is carrying on.